You know, the foundation is kind of a conduit or a pathway for people in the community who have the impulse. I wish I could do something. And the foundation is that avenue where we can channel that impulse and those resources to where they're needed the most.
The foundation is so helpful in helping our hospital meet the diversity needs in our community. After all, we're a college town, a rural community, a suburban community, and an international community because of the presence of Miami University. And out of this diversity come unique needs, and our foundation is able to support with funding some of those unique needs that would not be able to be met. And so the foundation adds an enormous value to what this hospital can do for each and every one of us.
Being an Oxford community member for over 20 years, I have utilized services at our hospital, and I am so appreciative of what we are able to do to ensure that healthcare is in our community and that we can deliver it at the highest quality.
As a team member in the foundation for over 5 years, I'm still amazed at the impactful generosity and compassion that this community has granted the hospital and the foundation. In turn, we, the foundation, can then fund services and programs and equipment needed in the hospital and services in the community.
We have the privilege of bringing new life into our world every day. We also help people overcome significant challenges in their lives when they face a major diagnosis. And we're also here to support those people who are in their last life chapters.
The foundation has provided financial support to allow us to provide mental health first aid. We've trained over 700 community members, including all of our sworn police officers in mental health first aid. That's a big need in our community.
The foundation was very generous and allowed us to send 2 technologists off for training in mammography and echocardiography. Those are 2 areas that are very important to the hospital, and we want to enhance our technologist skills so that they are up to date with the latest technology and they can provide the best care possible to our patients.
A few funds that I can speak of are the McLean Fund, which helps support patient and staff education, the Baby Bound Fund, which helps support prenatal classes, prenatal needs, and prenatal education, as well as needs that may arise once a woman has given birth. And then also the OB Services Fund, which helps support OB services and, again, staff education, which is foundational to the care that we deliver to our patients every day.
Well, I think the hospital is very important, being here and being in the location where people are. When I've served on the courtesy desk, I've had people come in and say, oh, it's so good to be in a small hospital where you don't get lost, where you know people, and we appreciate the special care they give to people that are here.
It's so easy to get in and out of your own community hospital that has provides great care and has great doctors to service the community.
And you never, ever want to take for granted the fact that we have a community hospital here that goes back to 1957, and we don't want to lose having that opportunity to be close to health care and medical care that this area deserves. But we want to expand a little bit, and we want to be able to help with healthcare initiatives across the community.
Here in Oxford, where we have a large student population and emergencies come up, and having a stable, steady, reliable place for students to get good care is essential for who we are.
We're very excited to have the patient emergency funds available to our patients and families. We will be able to help them with various needs that they may have, such as medication assistance, transportation, gas cards, food cards, just lots of basic needs that we'll be able to help them with.
Well, one of the main reasons we give, obviously, we want the hospital to keep up to date, but we like to give to local organizations.
The foundation has been very generous to my departments, and it feels right to give back. It's a way for us to continue to make sure that the hospital stays very healthy and it is a way for us to make sure that the community always has such a great resource.
It's part of our life. And in fact, from toddlers to our 90-year-olds, it's been a wonderful place for medical care for many years for all of us.
When I think of McCullough-Hyde, I think community. I immediately think of a place that I can bring my family and know that they're going to get first-class care.
Healthcare really, it's not operations, it's not ER visits, right? It's being proactive, it's looking at the total body, the total health, right? It's looking at how do you ensure someone has a better quality of life.
Generations of Oxfordians have given so much to this great and wonderful hospital. And I want to ensure that the legacy of Oxford, McCullough-Hyde, and the greater Oxford area is enhanced and improved for generations to come.
Donors to the foundation are such an essential part of the work that we do each and every day. Contributions are able to provide resources for team member education, the purchase of equipment, and services. We are so grateful for our donors who help to ensure that our foundation will always be here for McCullough-Hyde Hospital.
So it's up to us to do whatever we can to assure this hospital continues its vital mission hand in hand with the McCullough-Hyde Foundation.